in the sick people at different stages of formation of the disease. And also this science, this part of medical science, studies different conditions of the seeking medical help. In the process of studying medical psychology as a subject, difficulties which are presented with the lack of general ideas about the clinical disease, about the integrity of the patient's psyche, and so on. In the literature, there is a well-known terminology blur and confusion in the definition of medical psychology. The term medical psychology at different times had different actions and accordingly a different understanding, the different meaning. For a long time, the study of medical psychology was carried out with the framework of the concept of clinical psychology. For the first time, the concept of clinical psychology was proposed by Whitner at the beginning of the 20th century. But in the fact, as a concept, it was formed only in 1946, when Gelbach, the next psychologist, medical psychologist, suggested that the phrase clinical psychology be understood as a psychology in somatic medicine. Later, in the 1930s, Cherams first proposed to consider clinical psychology as a broader concept. And this concept, this part of the science, includes psychological knowledge, includes specific techniques and methods in a broad clinical sense. So, the definition of medical psychology and its place among other medical science are still understood in different ways, and different specialists understand in different ways. What is common is that medical psychology deals with the borderline area between medicine and between psychology. At the same time, the studies the problems of medicine in psychology aspects. It's the main purpose of medical psychology as a science, as a separated science. The medical psychology has specific structure. Medical psychology can be divided into two big groups. It can be general and private parts. General medical psychology is studies general issues and includes following sections. First of all, it's the basic laws of the psychology of a sick person, is the main concept of medical psychology. The main criteria for a normal, temporarily altered and painful psyche. Then this section includes the psychology of a doctor or medical worker in general concept, yes. Then the psychology of everyday communication between doctor and patients, between doctor and patients' relatives, and so on. Also, its law psychology includes psychological atmosphere of medical institutions, for example, in the hospital, in the department, general hospital. Then general medical psychology includes psychosomatic and somatopsychic interactions. During our circle, will discuss what is the psychosomatic disorders and what's the difference between several forms, between different forms of psychosomatic disorders. Next section of general medical psychology, it is individuality. Of course, we mean different temperamental characteristic. Character is general, or we can call it like personality. Then we can mention the evolution and stages of individuality postnatal ontogenesis. In this stage, very necessary to aim at childhood or adolescence or adulthood and late age, so different ages of personality. Also very important to aim effective evolutionary processes. What does it mean, evolution processes? We can mean different stages of development of personality and general characteristic of personality. The next section of general medical psychology is a medical deontology, which includes different issues of medical duty or medical ethics or medical confidentiality and so on. Next section, it's psychohygiene. We will speak more detail about psychohygiene in our circle of our lecture, but now I will say we'll try to describe the general concept of psychohygiene. By psychohygiene, we mean psychology of medical advice and consultations. Can be family psychology, it can be psychohygiene of persons in the crisis periods of their life, for example, or it can be psychology of marriage and sex life. It can be psychohygienic training. It can be psycho training of the relationship between doctor, for example, if we speak about medical psychology, it can be between doctor and between patient. Yes, it's more strict example of psychohygiene. And of course, we must explain general psychotherapy. Yes, as one section of general medical psychology, general psychotherapy. So sometimes basis of help in medical psychology. And the second group, it's a private medical psychology. Private medical psychology studies a specific patient, namely features of mental processes in mental patients who have psychiatric problem or psychological associated problem and so on. Private medical psychology includes the psyche of patients at the stages of preparation or performing surgical interventions or after surgical intervention period and so on, in different stages of management of treatment and so on, not only surgery as a specialty, medicine specialty, all medicine specialties. Also, private medical psychology includes features of the psyche of patients suffering various diseases. Of course, very common form infection diseases like a COVID-19, and so on. But besides it, of course, in the first place, we must mention the cardiovascular problems. Yes, it can be oncological problems, gynecological, skin, and so on. There are a lot of forms, and we must learn about them. Then, private medical psychology includes a concept of the psyche of patients with the defects in organs and systems. For example, blindness, yes, or deafness, and etc. Also, private medical psychology includes peculiarities of the psyche of patients during labor. It can be military or, forensic examination, and etc. Private medical psychology includes idea about psyche of patient with alcoholism or drug addictions, of psychoactive substance addictions, and so on. And of course, as a general basis, like summarize all these knowledges, yes, on the of this way how to help for patient, we must mention that private medical psychology includes a private psychotherapy. It is possible to single out specific clinics where the knowledge of the relevant sections of medical psychology is applied in practice. First of all, we must discuss the psychiatry clinic, of course. Yes, like is a leader in this area. In a psychiatry clinic, it means parapsychology. In our practice classes, we will discuss with you different methods of examination, forms of tests and techniques which we use in parapsychology when we analyze different cognitive components, pathology of memory, of attention, of thinking, and so on. It's a general concept of medical psychology. In next sphere area, it's in neurological areas. We can mention neuropsychology, yes, and in somatic, it's also psychosomatic disorders and psychosomatic disease. Parapsychology, first of all, let's of course begin with the parapsychology studies. According to great and famous Russian, not only Russians, or people, psychologists all over the world know this scientist. I mean, Zygarnik, divided into three structures. The main concept of Zygarnik is divided psychopathological studies into three into the structure of mental disorders. The patient of disintegration of the psyche and they comparison with the norm characteristic of mentality. At the same time, parapsychology uses psychological methods or operates with the concept of the modern psychology. Parapsychology can consider the task of both general medical psychology, when, of course, I mean private and general medical psychology, yes, when the laws of disintegration of the psyche, changes in the personality of mental patients are studied. And in the second, if we mean second group, private parapsychology, in this stage we must explain this psychopathological study when the mental disorders of a particular patient are investigated to clarify the diagnosis or conduct labor, forensic or military expertise or diagnose and so on. Second group, it's neuropsychology, is close to parapsychology. The object of study of which is diseases of the central nervous system, mainly local focal lesions of the brain. And the third one, the psychosomatic studies. Psychosomatic studies mean the influence of the psyche on the occurrence of somatic manifestation. So there are three main forms: neuropsychology, psychosomatics, and parapsychological parts of medical psychology. When we speak about subject of medical psychology, we must can mention the definition of Lakosin and Shakova, which with scientists, they were the leader in this area. They discussed first scientists who describe this phenomenon. So according to their opinion, the subject of medical psychology is various features of the patient's psyche and their impact on health and illness, providing an optimal system of positive psychological influence. And the second subject is the examination and treatment of a patient, in particular specific in system of doctor health care working patient. So between doctor, between his patient, their relatives, and between other doctors in the general general society. The object of medical psychology is a person, of course, but person with different difficulties or psychological difficulties of adaptation or self-realization, and these, of course, these difficulties based on the a lot of components. First of all, it's the psychological components. It is problem with social adaptation, his spiritual condition, and etc. But the base, of course, the person, the illness patient, of course. The goal of medical psychology. The goal of medical psychology is to increase mental resource and adaptive capabilities of a person. Yes, you can read this goal on your screen. Besides this, of course, the main goal of medical psychology to harmonize mental development in general population or in particular situation. Of course, health care, psychohygiene, psychoprophylaxis, psychotherapy, and so on. Then prevention and overcoming the elements, one of the main goal of medical psychology, and psychological rehabilitation, psychorehabilitation. We will discuss this chapter, this separated, very important chapter. The main task of medical psychology, you can read in the screen too, to study the psyche and behavioral features of the patient and those around him, like relatives, medical personnel, and different stages of their communication. Not only communication inside the hospital, inside the treatment, this process, but after very often when medical psychologist helps to change the relationship between doctors and with their family, and their friendship, and so on. So I want to let you know that medical psychology means more than just medical help inside the hospital. It's a very complicated and interesting subject which can be which you can use not only in your professional life but in your individual life too. The next, my idea about relationship of medical psychology with in other parts of medicine, with other sciences. Of course, all emerging and related problems of interaction between the patient and the medical staff are considered and evaluated in the light of the main task. What's the main task? Of course, to provide the maximum possible and effective assistance to the patients, like the main task of all medicine, yes, of all your life. But at the same time, medical psychology, yes, studies the problems of medicine in the psychological aspects and the methods of psychology in the medical aspects. The activity of medical psychology is reflected in the activities of various parts of the healthcare system. It can be a hospital, it can be sanatorium, it can be pharmacy, it can be outpatient at different stages of consulting or psychotherapy. It can be research work too, of course, in the field of healthcare organization and some another aspects. Medical psychology develops in close interaction with the next specialties. First of all, the leader of course psychotherapy. Yes, then psychiatry, neurology, neurosurgery, oligophrenopedagogy, occupational therapy, and etc. A lot of science, a lot of medical specialties associated with the medical psychology. Medical psychology has a significant impact on the development of general theoretical issues of psychology and the general psychology. First of all, the ratio of social and biological in the development of the psyche. It's the main idea of the impact and development of general psychology. Then analysis of the components that make up mental processes, the development of mental processes, the specific mechanism of mental processes, and so on. Then the next one is development and disintegration of the psyche. Then next, the role of the personality component in the structure of various forms of mental activity. It's necessary to mention that medical psychology uses the knowledge of pedagogy, of sociology, of philosophy, all medicine specialties. The need for an integrated approach permits the entire work of a medical psychologist. The main role of psychological knowledge, the main role of psychological knowledge in the work of a doctor. First of all, we must discuss that position of the basic of psychology allows to see the mental reaction common to all people. This approach allows to overcome the rejection of someone else's point of view, and besides it, to build the sense of trust between the doctor and between the patient. The purpose of medical psychology, coincides with the purpose of medicine as a whole. It is the pursuit of a state of health, which means not only psychological but also psychological well-being as a main general concept. Psychological knowledge can be used in medicine for several purposes. First of all, with medical psychology, we can diagnose the psychosomatic and somatoform disorders. And you know that's a very widespread group of disorders and diseases. There are a lot of psychosomatic and somatoform disorders, not only in psychiatry, all medicine. It can be neurology, therapeutic disorders, and so on. Then, psychological knowledge can be used in expertise in case of international concealment of the truth. Yes, it's the second place of purpose medical psychological knowledge. Then we can use psychological knowledge for predicting the patient's behavior in the conditions of examination and treatment. It's very important. Then also we can use psychological knowledge for involvement of the patient and his relatives in the treatment processes. And also we can build trust or very deep relationship between doctor and increasing his authority. When we speak about psychological knowledge, how we can use psychological knowledge, very important to mention that using a psychological knowledge, we can overcoming the psychological stress of the health workers themselves. It's very important, as you know, yes, because it's more specialty in all the world, I mean medicine, doctors, yeah. Then using psychological knowledge can help us formation the favorable working climate in the medical team in the hospital. Then psychotherapeutic treatment of somatic and mental disorders in general medicine. Also, psychological knowledge can be used for relieving the suffering caused by the disease in the patient and his relatives.